So, Dr. Goyal is the founder and CEO of First Primary Care, a direct primary care practice in Houston. We met long ago, back before I was in Congress, and frankly, was one of the first to introduce me to this entire concept. And so, Dr. Goyal, on your website, it says the traditional healthcare system is broken, and it's putting the health of millions at risk. So what do you mean by that, and why does direct primary care fix that problem?
Yeah, thank you for having me, Dan. And again, I'm excited about the journey that you are having and the work that you're doing to fix healthcare. So, why is healthcare broken? I think, healthcare is broken because people, when they think about healthcare, they think about health insurance. And role of insurance, whether it's through private companies or through government run programs, has expanded to cover everything and anything under healthcare. And that has led to two main problems, in my opinion. Number one is it has inserted middlemen in between the patient and doctors at every step of healthcare. And number two, it has completely alienated the patients from what the true cost of healthcare is.
Mm-hmm.
So nowadays, nobody knows what healthcare costs, and that is big reason the cost of healthcare has been inflated so much, and subsequently the premiums keep rising. And then we use insurance to cover, risk, big, bad, ugly stuff. It should not be used to cover preventive, minor urgent care, disease management, wellness. Insurance should be out of there and should go back to just covering big, bad, and ugly stuff the way it is supposed to be.
Right.
And 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 that's what direct primary care does, right? Direct primary care basically eliminates third parties from between a doctor and a patient, gets them working to keep people healthy, and then you wrap it with an insurance product or a cost sharing product to cover the unexpected big bad ugly stuff.
So, how many in your practice? How long has it been going on, and how many patients do you all serve?
Then we started in 2016, so it's almost 5 years going on now. We have about 2,300 members, all in Houston. We have three locations, and we take care of several, small business owners, self-employed people, all sorts of people. Basically, are utilizing us for their primary care.
And how much does it cost? So, if I want to go sign up with you right now at First Primary Care, what is the cost to me per month?
For you, then it'll be $100 a month. But in general, if we work with employers, we are able to do that for about $75 per month per employee.
Wow.
And if you join, your kids can actually join at just $25 per month.
Oh,
And
really?
what you get is, yeah, unlimited access to your doctor via text messaging, video calls, phone calls, and in-office visits.
And what
No
what
extra cost.
and what kind of services? And I know it sort of varies possibly from DPC to DPC, but generally speaking, what kind of services? I mean, because we need to remind people it's not insurance. It's not for a serious illness or a break in your leg. But what is it for? What would people
Yeah.
expect?
So I think I can describe it better if I give you an example of a patient. So just before we got on the call, I saw a new patient this morning. So this patient signs up with us. I first do an introduction call with this person saying, hey, welcome to our practice. Tell us what you are looking for. And most people give me an answer. Look, I've never had a relationship with the primary care doctor, and your model sounds very intriguing. And so then what I do is over the phone, and by this time they have already done a small intake form for us, which helps me get to know them a little bit better. But over the call, I quickly discover some issues and I send them to do a lab panel, and then I visit them in person.
Mm-hmm.
And I had an hour visit with him. getting to know him about his sleep, exercise, diet, family history, his prior medical history, going over the lab work. And basically we come up with, okay, what are the priorities health-wise you need to work on? What are the lab abnormalities that we need to work on? This gentleman may actually have diabetes that he doesn't know. So we're going to then make a plan how he can fix this diabetes, not just throwing medicines at him, but talking about lifestyle changes. And then this model allows me to have a relationship with my patient remotely via text messages. He's going to watch his blood pressure. That automatically goes into the app, and that app comes into my medical system. So I can be in touch with this person more on a continuous basis rather than seeing him every 3 to 6 months and not knowing what happens in between. So I will be available to him for any questions regarding his medications, regarding his health. If something unexpected happens, he needs urgent care, whether it's, a cold or a flu or a headache or an injury, he's going to start everything with me. And our model eliminates access issues, right? Now he's connected to his own doctor via, just a push up a button.
Right. Yeah, and you're a quarterback for follow-on care too. Like you said, people generally probably can't tell you who their direct primary or who their primary care doctor is. They're used to just a very confusing experience anytime you need to use the doctor, especially if it's rare, or if it's unforeseen. You got to wonder, okay, do I have to pay a copay? How does this even work? How do I, It's such a confusing system, but with this, it's really not, and it's affordable too. I mean, from what I see, it looks like the cost moves between about $50 and $100 per patient, and I'm sure that changes from doctor to doctor, changes from what kind of services are provided, and patients can actually look that up. I mean, there's a website now where you can look up if there's a DPC in your area. And then you can choose, just like you would choose any other kind of service. And I think people really love the flexibility. How widespread is it at the moment? I don't know if you know the answer to this, but what percentage, say, of primary care doctors out there are using this? How many are across the nation? Do you have any idea?
Roughly. So I can tell you that the numbers of doctors doing direct primary care has definitely increased over the 5 years that I've been in this. Even just in Houston, then, like, we were the second practice to start doing it, and there are probably about 10 practices that are currently doing direct primary care. Overall in U.S., probably we have about 1,300 to 1,500 DPC practices. So definitely a lot of growth, but I think if you look at how many total primary care doctors, I would say that's probably still a drop in the bucket. Probably 2 to 3% of the doctors that have left kind of the traditional way of doing primary care and joined or opened a DPC practice. Yeah.
Yeah. Do you see a lot more room for growth?
Absolutely. Jen, I honestly think that we cannot fix our healthcare mess unless we fix primary care. And if we want to fix primary care, we have to figure out a way how to make direct primary care mainstream, because it helps the physician a lot by letting them be what they were trained to be, and it improves patients' access, relationship with their physicians, brings transparency into the system.
And so go ahead.
I was just going to say it has to be this way, I feel like.
Yeah. No, people definitely want, you ask people what they want. They want personalized care. They want choice. They want a doctor they trust. What about low income people? What about the people who can't afford $100 a month? That might be affordable for me. And a pretty good deal. But what about the people who can't? Is there, what ideas do you have on that?
Absolutely. Great question. So my first, response to this is what do we do currently for these people, right? Like, how are we helping these people currently? And there are some government programs like Medicaid, like we have a CHIP program here in Houston, where low income people can get those programs to pay for their healthcare. So I think we need to redesign those programs where we are empowering low income people with like a health savings account, and even contributing some, dollar amount to that account, and encourage them to get a direct primary care doctor, basically. And the reason is this: once we get them good primary care doctor, they will start getting healthier, and they will stop going to emergency rooms and hospitals and stuff, unnecessarily.
Right.
So, we have to make our existing programs, first of all, work better for our low income people. And DPC is a good way to do it, but it has to be done in a way where patient chooses which doctor to get.
Yeah.
Because that, again, keeps the sanctity of their relationship intact. It shouldn't be that I provide care to a low income people and then I got to bill government to get paid. Right. That, again, defeats the purpose.
Right.
Of
It's
being
so
direct.
convoluted.
Yeah.
It just turns out that, I have a bill that that puts us on a path towards the solution you're talking about, which is what we're rolling out this week with this podcast. And a couple aspects of it are allowing health savings accounts to pay for direct primary care, but also making it in law that that states can apply for a waiver to experiment with Medicaid availability for direct primary care also. So it, again, it uses the system in place to get to this, to I hope eventually get to a more simpler plan of basically exactly what you described, where maybe you're putting those dollars, instead of wasting them on government bureaucrats, but just putting them directly into that health savings account where they can choose their doctor. It's worth noting that another thing that people really need besides healthcare is food. It's just something you can't survive without, as it turns out. That's just a fact. But we don't have some like government manufactured food program. I mean, we give people SNAP, we give them food stamps, and then they choose what to buy. I mean, there's some limitations, of course, but for the most part, like there's a market of food that when we let that market prosper and thrive, and we still realize that there's people who just can't afford the market, and so we help them afford it. It's a very simple concept, and it seems to work. Okay, for all its faults, I mean, SNAP works a heck of a lot better than our healthcare system and Medicaid. And what you're describing is effectively along the same lines of reasoning, the same principle. No, it's great. And what does it do? What's your experience with seeing how this affects insurance premiums? Because as you contract with businesses. And have you talked to insurance companies about this, about them lowering premiums for people if they subscribe to direct primary care?
Yeah, so absolutely. And so we work then with self-insured companies, right? So self-insured companies are ones that hire a third-party administrator to kind of put a plan together. And so they are not like just paying premiums to a Blue Cross or United Healthcare, right? And that self-insured product allows us to, have visibility into what's happening on kind of the larger claim side of things. So when we work with these self-insured employers, we have seen the costs come down significantly, actually, and this has been the experience of everybody around the country. There are a lot of DPC practices working with self-insured employers. And I believe you see on average $1,000 to $3,000 per employee per year savings in total healthcare costs, which is huge. We work with company about 120 employees. They saved 250,000 the first year they joined us from kind of the previous year. Medication costs go down, lab costs go down, imaging costs go down. People go to the emergency rooms much less. People end up in the hospitals much less. If they do end up in the hospitals, post-hospital care is, way smoother with us than in any other model.
Right, because you already know them. You already know the
We
person.
already know them. Yeah,
Yeah.
exactly. And we've been in touch with them while they were in the hospital, knowing what's happening.
Right.
So definitely cost savings are seen. I do wish there was, more transparency in some of the higher cost things, which is again, I think a lot of progress has been made by this administration in the last few years to kind of push cost transparency in healthcare, which is, huge step in the right direction.
Yeah, no, it certainly is. That's just an exceptional story. Appreciate you, doing what you do and sharing it with us. So, Dr. Goyal, thank you so much for being on.
Absolutely. My pleasure, Dan. All the best.